Some people they are being suffered. There is massive change in the oral flora from the remnants of the toe. Iceberg जो ऊपर से छोटा दिखता है लेकिन bone के अंदर ये बहुत ज़्यादा होता है. We can extract DNA from that. There starts the demyelination of enamel.
Let's bridge the gap. A social outreach initiative by Dr. Ishrat Shakeel.
Assalamu alaikum wa rahmatullah. Okay, so this is the story.
Think about the dentistry and all the things.
Okay.
We welcome Dr. Syed Suhaib on the podcast, Let's Bridge the Gap.
मोहतरम नाजरीन व हाजरीन, मुझे आज बेहद खुशी हो रही है कि मैंने आज जिन बरकरार को आज मदऊ किया हुआ है अपने प्लेटफार्म पर, यह हैं डॉक्टर सुहैब जीलानी जिन्होंने BDS किया है और अभी गेस्ट लेक्चरर है एट सेमी बीरवा वेयर he has been teaching pharmacology and pathology to the BSc nursing students, and additionally he is running a clinic at Bimna by the name of the Red Cherry Dental Clinic, and he is a member of the online teaching faculty of First Online University where he has been delivering the lectures. Welcome डॉक्टर साहब साहब, आप यहाँ आए, आपका बेहद मशकूर हूँ कि यहाँ आए आप. डॉक्टर साहब, हम इतना ही जानते हैं एज लेमैन कि हमारे दांत अच्छे हैं तो वी कैन स्माइल नाइसली, वी कैन स्माइल कॉन्फिडेंटली, वी कैन टॉक कोहेरेंटली और वी कैन च्यू नाइसली. इतना हम जानते हैं. इससे ज़्यादा मतलब जो मेडिकली है, मतलब अल्लाह ताला तबारक ने हमें किन बेहतरीन मतलब मोतियों से नवाजा है, 32 मोतियों से. ईच टूथ इज़ हैविंग ए स्पेसिफिक फंक्शन. दैट इज़ वाई अल्लाह ताला तबारक बार बार फरमाते हैं फतबारकल्लाहु अहसनु खालिकीन, मैं बेहतरीन खालिक हूँ. और उसकी एक्सप्लेनेशन देंगे. डॉक्टर साहब, आपसे मैं रुजू करना चाहता हूँ कि मेडिकली हाउ दे आर सो इम्पॉर्टेंट, वाई दे आर सो इम्पॉर्टेंट, एंड हाउ द अदर हेल्थ ऑफ इंडिविजुअल इज कनेक्टेड विद द डेंटिस्ट्री एंड गुड ओरल हाइजीन. प्लीज़.
जी, पहले तो सभी आपके व्यूअर्स को अस्सलाम वालेकुम व रहमतुल्लाह मेरी तरफ से. देखिए, ओरल हेल्थ या डेंटिस्ट्री की अगर बात की जाए, ये एक बहुत ही बड़ा साइंस है. जैसे आपने बोला कि अल्लाह मियाँ ने इसको कितना ब्यूटीफुली बनाया है. इट्स अ वेरी कम्प्लेक्स सिस्टम. वो इसको कितना प्रॉपरली ऊपर वाले ने बनाया है. मैं आपको एक दांत की एग्जांपल दूंगा. जो दांत है, इसके आउटर कोट को हम अपनी ज़ुबान में इनामल कहते हैं. एंड दिस इनामल इज़ द हार्डेस्ट नोन सबस्टेंस टू द मैनकाइंड. इट्स मोर हार्डर देन बोन.
ओके.
ये इनामल जो हमारे टीथ का आउटर कोट है, ये किस चीज़ का बना है? ये एक मिनरल है, कैल्शियम फॉस्फेट. कैल्शियम फॉस्फेट की वो सॉलिड फॉर्म जिसको हम टेक्निकल टर्म्स में हाइड्रोक्सी एपेटाइट कहते हैं. इट्स दैट थिंग ओनली. को इतना कॉम्प्लेक्स
मतलब हार्डेस्ट सबस्टेंस.
इट्स द हार्डेस्ट सबस्टेंस. इट्स मोर हार्डर देन बोन.
More harder than bone.
More harder.
So why does the person then suffer from the tooth decay and caries?
So caries has, there's a different science of cariology. Cariology is a separate subject. So caries का क्या मसला है कि this enamel has got one major problem, is that whenever in the vicinity of an enamel there is decreased pH. Typically we see the optimal pH of less than 5 if it goes in the oral cavity. Then this enamel starts demineralizing. Calcium chala never needed.
Because of the acidic nature of the saliva.
Acidic nature of saliva. How the acid comes in the saliva? That's because of the fermentation of the food that's done by the bacteria in the oral cavity. So that fermentation of a bacteria in the oral cavity will decrease the pH. When the pH is below 5, there starts the demineralization of enamel. That is the initial stage of a caries. That's how caries propagates and starts.
So it is by way of the bacterial growth that...
Yeah, exactly. Bacteria, the oral microflora, there's a separate oral microbiology.
Okay.
A separate science for the oral cavity, common cells, the pathogens, the different. And from when a baby is born to the 60, 70 years of old, there is massive change in the oral flora. Newborn baby has got a separated bacteria. Like there is a very predominance of Streptococcus oralis and Streptococcus salivarius. These are the initial bacteria जो oral cavity में आते हैं. Then in an adult, then to 40s, after 40s, after 60s, this oral flora continuously changes.
So we have to maintain or manage this oral hygiene.
Yeah.
But what about the infants? How do mothers keep the oral cavity of their infants or suckling babies clean? And what advice आप उनके लिए क्या advice दे सकते हैं?
Oral hygiene of a human, it starts when a human is born. It starts from the day one.
Okay.
Like there are different techniques we are not properly following. We are not educating our mothers. There's a proper frequency and proper technique of breastfeeding. So abnormal breastfeeding will predispose to the early childhood caries, or we can see nursing bottle caries are there. The upper anteriors are getting caries, they are getting decayed and necrotic. That's just because of
So it is the duty of the mother to
exactly.
keep the oral
It's a duty of a
hygiene
mother.
of the infant or the
In
child.
fact, we have got separate toothpaste, we have got separate oral rinses
Baby
for
toothpaste
the
and all
yes,
the
exactly. We have got nowadays we have got AI generated toothbrushes.
Okay.
Automatic toothbrushes, they have got inbuilt programs, and those programs will manifest as a typical technique, like phones technique for children's.
Okay, Dr. Saab, is it just to maintain the health of the oral cavity, or will it safeguard other ailments also?
Yeah, exactly. This is a portal. Oral cavity is a portal of everything. Whatever you're taking, it's an oral cavity. So first thing, if your oral cavity is clean, your remaining system will be clean. Immediate system is your digestive system. So if you're not chewing properly, you have bacteria in the oral cavity, you're engulfing food with the bacteria. And that's going into the stomach, then to the gut, they're absorbed into the blood. That's it. And there are some cardiovascular issues. They have got the pathogenicity related to the oral flora. Like there is a infective endocarditis. It's a very deadly disease.
Oh, it is connected with the
It's
oral
connected, yes, exactly. Or a patient who is having a prosthetic heart valve. If he comes to a dental clinic, he's an atom bomb for a doctor.
So what precautions the doctor has to take?
Yeah, I told you that in those patients, we prophylactically give antibiotic. If he's coming to the clinic, before 1 hour, we amoxicillin.
How can you diagnose a patient coming to you with a toothache that he is suffering with that cardiac ailment or that thing for which you have to prescribe the antibiotic?
Exactly.
How can you? Or you are going to advise the patient go for the screening first?
No, there are proper screening protocols. We don't do the procedures like that. We do the X-ray, and we see the OPG. If there is contradiction, we're not guessing it proper exact location, so we can prescribe OPG. And we have got CBCTs nowadays.
Okay.
We have got cone beam computed tomography. We can exactly judge the landmark of a bone or a tooth or a hard tissue there.
There itself.
Exactly.
You can do it and just carry on the procedure accordingly.
Yes.
But Dr. Saab, there are other apprehensions. Myself, as a layman, I too feel sometimes apprehensive while seeing my dental surgeon getting all the gadgets while extracting my tooth or just having that root canal treatment. Can't it be a source of infection to the patient?
Yes, this can be a source of infection. In fact, most of the recent outbreaks of hepatitis B in the outskirts of Badgam here in Khag area, the dental clinic infected I guess some hundreds of people with hepatitis B because they are not following the proper sterilization protocols. For a dental clinic, it's very necessary they should follow the sterilization, proper autoclaving, there should be proper chammering, every damn thing.
So the infants जिनमें इरप्शन नहीं हुई है अभी दांत उनमें भी तो ये प्रॉब्लम हो सकती है so far as gums and gum related ailments are concerned. Periodontal. What to say? Do you say?
Periodontal is a separate disease of oral cavity. It's a disease of periodontium actually. What is a periodontium? दांत के बगैर जो भी चीज oral cavity में है, whether it's a gingiva the covering of the tooth, neck of a tooth, उसके नीचे there is cementum, उसके नीचे there are collagen fibers, we call them as PDL, and then there is a bone. This tooth जो हमें oral cavity में दिखता है, it's like an iceberg. Iceberg जो ऊपर से छोटा दिखता है, लेकिन bone के अंदर ये बहुत ज़्यादा होता है. So दांत का root approximately 1.5-2 इंच का भी होता है कभी कभार, approximately. So there are different underlying tissues which are holding the tooth in a bone. That is called as periodontium. That includes the gingiva, that includes the PDL fibers, that include the cementum, and that include the alveolar bone. It's a socket in the maxillomandible. Okay. The roots are embedded in the socket. Alveolus we call it anatomically.
Okay, that is a separate topic.
That is a separate science. That's a periodontology. Periodontology is a science of dentistry that deals with the periodontal diseases, those diseases that occurs after 40.
People say that we don't require any transplant or we don't require any cap. बट फॉर द सेक ऑफ देयर कन्वीनियंस, जैसे कि लोग कहते हैं कि मुझे बात करने में दिक्कत हो जाती है, मुझे स्माइल करने में दिक्कत हो जाती है, मुझे चबाने में दिक्कत हो जाती है, तो उनमें आप प्रिस्क्राइब करते हो कुछ कैप्स और
cap is the prosthetic part.
Can we say that is the cosmetic procedure?
Yeah, that's a cosmetic procedure in which we take care of the cosmetics of a patient also and the proper functioning also. There has to be cosmetically, the patient has to be very appealing. If you're designing a smile or you're making the proper smile arc, that is a separate system. We check the ratios of a tooth. like ratios of, there's a proper ratio ki how much central incisor should be visible in a patient, how much percentage of the lateral incisor should be visible. So there's a proper ratio. With that ratio we can, so there's a mathematics in dentistry also of different angles and the values.
हाँ डॉक्टर साहब, जो ये फॉरेंसिक साइंस है उसमें फॉरेंसिक जो ओडोंटोलॉजी है उसमें है कोई रोल आपका?
ये डेंटिस्ट्री के साथ it is related, like there is a medical forensics and there is a dental forensics separate.
Okay.
We can get a criminal or a suspect by picking up the bite marks or the lip prints of the suspect.
You can pick up the lip prints of the suspect.
Exactly, at the bite marks.
And bite marks.
There is something. Some people they are being suffered. They are being tortured, and one of the syndrome that's called as battered child syndrome.
Okay.
When the child is being beaten when he's in a smaller age group, like 5, 6, 7 years,
Okay.
he's being tortured by a parent or some guardian.
Okay.
So we can pick up the suspect by checking the bite marks. Or
You can be helpful in just
forensic odontology. Yeah, forensic odontologist. There is a forensic odontologist.
Okay.
They separate. They exclusively work on the bite marks, on the lip prints, or the age estimation.
Okay.
We can
Age estimate. You can estimate
estimation
age
also
from the tooth.
from the remnants of the tooth, from the tooth or the stem cells or any odontogenic cell we have got.
Can we even get that DNA?
Yeah, exactly. Because
DNA.
we have got cells in the pulp, we can extract DNA from that.
Or you can trace it.
We can trace
to the
back.
person.
We can trace back. Then we have to compare it with the suspects. If there are 2, 3 suspects, we can pick up this has got a very good significance in the criminology.
Okay. Thank you, Dr. Saab. आप यहाँ आए अपना काम छोड़ के अपना clinic. You have always been busy with your patients and at the institute at Piyuba. अपना वो काम छोड़ के यहाँ आए. How do you feel? While being here.
It was very nice. Thank you very much.
Thank you very much. God bless you. Stay blessed. Wish you all the best.
Share, like, and subscribe to Let's Bridge the Gap.